This video is about how to review a chart before you go in to see a patient. There are certain things you're going to know before you go in to see your patient. For example, the medical assistant or will have the chief complaint written down, or maybe it'll be on the schedule what the chief complaint is. But there are 5 things that you need to be looking at in addition to just the chief complaint. And this is something you want to look at consistently with every single patient. The first thing you want to look at is your last visits. So I happen to be in a chart where I can see the last 2 years right here. So I can see when my patient was last seen. It looks like she was seen less than a month ago, and she got her COVID-19 vaccine. And nothing since back in December. Looks like she was seen in a lab for sleep apnea. And that was a transcribed order. Nothing else was done on this patient at that time. I'm going to go on, since there's no real assessment plan for my last visit. This is a 22-year-old female test patient. I want to look at the medications next. So I'm going to go to the medications tab. If you're in Epic, there's often a snapshot. So you can see in here everything. Demographics and pharmacy and immunizations, allergies, kind of everything. However, if you don't have that, here's the medications here. She looks like she's on Yasmin, and she has Prometrium. My suspicion is she's not taking both at the same time. So first thing that's going to alert me is that I want to check and see if she's taking both of those and why she would be taking both of those. If I don't have this, I'm going to go to the medications tab and look under here. And it looks like that's both listed as something that she takes daily. So regardless of what she's here for today, I want to look at, ask her about her medication so I can clean up that medication list. I'm also going to look at her problem list. Again, that's under the snapshot if you're in Epic. However, otherwise, I'm going to click on problem list, and it looks like she had COVID-19 a little over a month ago, and she also has a diagnosis of sleep apnea. Sometimes there's additional information in the overview if you're in Epic. I know that not everyone has Epic, but that might give you additional information. This one happens to not have any. I also want to look at my last diagnoses or labs. So I'm going to go to results review, and this one is going to show me my labs. She had her glucose checked, and it was elevated. So again, if she's here today, I'm going to wonder, it looks like it was normal initially on 12:03, it was normal on 12:10 at 10:02, but again on 12:10 when it was repeated at 10:53, it was elevated. So I want to know, was she doing a 2-hour glucose tolerance test that didn't get recorded correctly, or had she eaten between that time? If she was fasting, that's going to give me concern. So even though she doesn't have any diabetes, prediabetes, impaired fasting glucose on her chart, I'm going to ask her about that because I want more information to make sure that there's nothing missed. This patient happens to not have any other diagnostics done. There's other places that I could look for those diagnostics, but they're not here. So no other diagnostics to look at this time. And this happens, again, it just happens to be that I can look at the glucose on the side here. Then the last thing that I'm going to look at is health promotion. Again, so Epic is very nice. And so I have the care gaps here. She's due for a hepatitis screening, which is everyone from 18 and up at least once in their lives. She's 22 years old, and so she is due for a chlamydia screening. And you should know the guidelines on when these should be done. She hasn't had a tetanus shot, it looks like. She's been overdue since 2017. And so we want to give her a tetanus shot if that's something that's in the office and she is able to get today. And there's 2 other things. It looks like she's due for a pap smear, and she needs her flu shot, even though she's gotten her COVID-19 vaccine. So when we go in today, although we want to address the problem at hand, we also want to clean up her medication list. We want to confirm that there's not additional problems with that elevated glucose. And we want to talk to her about, hey, can we order a hepatitis C screen? It looks like you're due for an annual exam, and we can do your cervical cancer screening then. I've never seen a lipid panel on this woman, so maybe we could just get a lipid panel and CMP to make sure everything is good. I do see that it does look like she's overweight, which you could use with a BMI. Oh, it doesn't have her BMI calculated, but it's definitely elevated. So you could use that as your diagnosis. But these are things you want to talk to your patient about before you walk in the door. So even though I have not seen this patient and I'm not looking at what the chief complaint is, by looking at the assessment and plan from the last visit, the current medications that she's on, her current problem list, her diagnostics, including her any labs or x-rays, other things she's had done, and looking at her health promotion and this it calls it care gaps, those things that we're going to look at to see what else needs to be done today. I recognize that this is not something that you may be able to work on at every visit. However, you want to put in your plan that she's due for these things. You recognize it, you saw it, you made a plan to address it. And that's it. Just a note, there may be other things that you want to look at, but in this case, I don't, this is something that the 5 items you want to look at with every patient.